Welcome everyone it is my privilege to be the first to welcome you to the launch of Private Lives 3. My name is Adam Bourne and I'm Associate Professor of Public Health and one of the Deputy Directors at the Australian Research Centre in Sex, Health and Society at Trobe University. I'm also one of the co-investigators and co-authors of the Private Lives 3 study. Before starting today's proceedings, I'd like to begin by acknowledging the traditional owners of the land on which we meet in our many different parts of the country and recognise their continuing connection to land, waters and cultures. I pay my respects to their elders past, present and emerging. This week marks NAIDOC 2020, a time to honour and celebrate our First Nations communities. This week, as every week, we acknowledge that this is, was and always will be Aboriginal land. The findings of Private Lives 3 have, I know, been long awaited. It's been 8 years since the Centre was last able to undertake this study and much in the world has changed around us. This report that we're launching today provides us with a snapshot of lives for LGBTIQ people in Australia. It tells us about the challenges that many are facing, as well as the ways in which we're connected to and draw strength from one another. We're thrilled to be able to share the final report with you and take an opportunity today to thank the many, many people who made it possible. While COVID-19's deprived us of the opportunity to come together in person as a community for a celebration, it has at least ensured that more people than ever from across every state and territory are able to join us for this online webinar. Today we'll hear from a range of speakers who will reflect on where we've come from, the history of Private Lives as a project, and what a program it's sought to accomplish over the years, as well as reflections from a panel of speakers on what these data and their findings mean today. The ways in which they can inform our practice, our policy, the myriad of other ways in which we can work together to effect meaningful change for all parts of the LGBTIQ community. Today marks the start of this process, and there'll be many different people who need to be sat around many different tables or Zoom screens in the coming weeks and months as we seek to make sense of these findings and consider the ways in which they can inform our work. But to formally open today's proceedings and to officially launch the Private Lives 3 report, we're really excited to be joined by the Honourable Martin Foley, Victorian Minister for Health, Minister for Equalities and Minister for Ambulance Services. And while he now finds himself at the centre of the largest public health challenge the world has ever known, Minister Foley continues to be a staunch supporter and ally to LGBTIQ communities. He's facilitated a number of nationally leading initiatives to tackle exclusion and discrimination, and I personally know that he always takes the time to ensure he's connected to LGBTI organisations and advocates working on the front line so he can be across the issues of most importance to our community. Minister Foley, we're very grateful for you taking the time out of your exceptionally busy schedule at the moment for this event. The floor is yours for the opening remarks.
Thank you very much, Adam, and thank you for your work and the Centre's work. And it's a great honour and a privilege to be part of the launch of such an important piece of work, which I'm confident will be even more central to the knowledge and the advocacy that has flowed from the first two reports. Like you, I begin by acknowledging the traditional owners of the land on which we meet. We meet on very many various locations across Victoria and Australia, and I pay my respects to elders past, present and emerging, and to any and all Aboriginal people who may be attending this important event. And I do so by particularly recognising, like you, that in NAIDOC week, the reflections that LGBTIQ plus people are living on lands that LGBTIQ plus Aboriginal people have lived on for millennia, and that Indigenous knowledge and potential has and is enriching the efforts of progress towards equality for all of our rainbow communities. And I want to particularly acknowledge that significant contribution. It will underline many of the work through treaty and through treaty conversations, and the Victorian government is going to continue to build that respect and understanding and intersection between Aboriginal and queer cultures to the benefit of all Victorians. Can I express my profound gratitude to the researchers at La Trobe, at the Australian Centre in Sex, Health and Society, for bringing Private Lives 3 to life. I would also like to recognise the leadership of the Vice-Chancellor, Professor Dewar, and I would like to thank everyone who is part of the proceedings here today who supports LGBTIQ plus Victorians in the many ways that you are all involved with the Victorian Government's LGBTIQ task force, whether it be the whole of government group, the Health and Human Services group, the education group, the justice group, and more importantly, just the endless contributions and advocacy you bring to ensure decency and equality for LGBTIQ plus communities. As Adam touched on, the last year has been extraordinary and challenging, and your efforts have been greatly appreciated. And excuse the dog barking in the background. Private Lives 3 matters in so many ways, and I hope even more than Private Lives 1 and 2. I just want to talk briefly about the research and why it's important to a Victorian government approach which is consciously designed to build on the work that Private Lives 3 has put in place. It is so important, Private Lives 3, because it clearly paints a picture of what life is like for LGBTIQ plus people in Australia today. Private Lives 3 is the largest national Australian survey of the health and well-being of LGBTIQ plus adults. More than 6,000 people have shared their experiences in so many parts of their lives: relationships, family, housing, health services, disabilities, intimate partner and family violence, and community connections. The data is detailed enough and in-depth enough to show us that different experiences of particular communities vary across the LGBTIQ rainbow, and therefore raises all sorts of, what we know, intersectional issues, but now we have the evidence that can underpin our advocacy. And this research builds on the finding, as we all know, of the previous 2 Private Lives surveys. I think it's fair to say that this information is crucial for all of us to firstly understand if we want to continue progressing equality for rainbow communities. It's important for governments, it's important for health professionals, for service providers, for community organisations, and for activists in their own communities. Some of you might be aware that here in Victoria, we are going through an extensive process of developing the first whole of government LGBTIQ strategy. And whilst we'd like to think we have made great strides towards equality in Victoria over recent years, this survey, and perhaps more importantly, the reflections over the COVID period, have shown us just how long and how far we still have to go. The amplification and the magnification of many of the issues that are touched in this report are played out in an even greater lived experience in the COVID world that we're all now part of. Once the whole of government report is released next year, this strategy will help direct our efforts, I hope, for years to come. To create this strategy, we've asked Victorians how they thought government can partner and help improve the lives of LGBTIQ plus people. Some 800 people, groups and organisations have had their say during this consultation process at the height of the pandemic and the restrictions that were in place. Throughout that process, one of the key themes, indeed one of the key themes in the more than 10 years that I've been involved in different levels of government support and allied work with the LGBTIQ plus community has been data. People and organisations scream for data to underpin what they know to be their experience for LGBTIQ plus people and their families. Data that shows how others across the rainbow communities need support. Data and evidence that helps people who do in fact support LGBTIQ+ communities can create tailored policies and programs to express the needs and the programs that community themselves wish to lead. The significance of data like this is why the Victorian government was from the get-go proud to support the Private Lives 3 project. Data underpins why it's an important part of both changing and saving lives. I have no doubt that this research and the content of it and its application will help to achieve precisely this. So, what does the data tell us? Whilst there is some good news, and we should always reflect on good news, there is much still to do. On the good news side of things, a majority of participants report that they feel accepted at work and among their families and in educational settings. A majority are also connected in romantic relationships. That's lovely. But ultimately, this research shows so much still has to be done, that there is much more work that needs to achieve a real outcome of equality for LGBTIQ+ people. LGBTIQ+ people remain more likely to experience all the things that communities have been telling governments for years. Overrepresented in poor mental health outcomes, in harassment and abuse, in homelessness, in challenges with alcohol and other drug use, in intimate partner and family violence, way above what the broader general community experience. The specific figures for these areas can be difficult to process, and all of them individually will be the subject of much consideration and I'm sure much advocacy. But together they continue to be a damning condemnation of just how far the Australian community still has to go in achieving real equality of outcomes for LGBTIQ+ communities. For instance, 1/5 of LGBTIQ+ people surveyed had experienced homelessness. 1 in 5. That is way, way over every other comparative community's experience, with a couple of exceptions, particularly our Indigenous community. We know that many of these stem from the basis of discrimination. Far too many LGBTIQ+ people felt they had been treated unfairly in the year before the survey because of who they are, because of their sexual orientation. This was true for 3 in every 5 people, 60%. Sadly, as we've seen the politicisation, particularly of trans and gender diverse communities, trans and gender diverse participants were even more likely to feel that they had been treated unfairly because of their gender identity. These are pretty tough statistics to read and to comprehend, because behind numbers lies trauma and disadvantage and real people's story. They represent confronting experiences and day-to-day reality for thousands of people. It's important for us to consider the time period in which this survey was conducted, pre-COVID. It ran from July to October 2019 and asked people to reflect on the experience of the immediately preceding 12 months. That included the first anniversary of the same-sex marriage postal survey, an awful reminder and trauma trigger point, despite the celebration and the exuberation at the time for LGBTIQ+ Australians. During this time, particularly trans and gender diverse Australians still faced divorce from their marriage partners as if they changed their birth certificates. The federal government's Religious Freedom Bill was also released in this period, which invited far too much negative commentary on the rights of LGBTIQ+ communities. Experiences of discrimination like these add up and they cumulatively impact on people's mental health. Private Lives 3 makes this extraordinarily clear. And whilst I'm pleased that our government has been able to provide mental health resources to LGBTIQ+ communities to help grapple with some of these experiences, we all wish it hadn't been needed, but we all know that whether it be the Victorian Royal Commission into our mental health system. The Commonwealth's still to be released Productivity Commission inquiry into mental health. We know and services. We know that there is so much more that needs to be done in those areas for our LGBTIQ plus communities. Private Lives 3 also paints a picture of attitudes towards how people deal with intersectional identities, how people living with a disability or from a multicultural background can also provide an unfair treatment for parts of the community to be who they are through the rainbow intersections. This reiterates the need for all policies to recognise that people are not just from one community. There are so many parts to who people are and how all of these components can influence people's lived experience, their life outcomes, and their expectations for the future. This research clearly was conducted before the coronavirus pandemic. We know so far that this COVID pandemic globally has, and the crisis that it has rained down on the globe, has made that many of the challenges that were faced by LGBTIQ plus Victorians and Australians have been even harder to bear in 2020. And I have no doubt that there will be further research that will supplement this great work that will further amplify that. But however, Private Lives 3 remains the important reminder of the work that is still to be done, the work that is left to achieve equality for all LGBTIQ plus communities. So in Victoria, we will continue to draw upon research such as this in framing our policy and program approach, and we are in progress well down the path of creating that whole of government strategy that I referred to earlier. We know that this will lay out the combined work of that strategy and Private Lives 3, will lay out areas for us to focus reforms that improve outcomes, real lived experience for LGBTIQ plus people for many years to come, similar to the reliance that we all placed on Private Lives 1 and 2. The process of creating this strategy and having brought it to life will be much more effective with the comprehensive data and support that this work has allowed us to build that on. While there is always the need for more research, while circumstances are always changing, Private Lives 3 will provide a solid foundation and a rigorous, really significant base that all of that advocacy work can be built on. So please let me end by thanking and congratulating the Trobe's Australian Research Centre in Sex, Health and Society, and all of the researchers and all of the participants who got us here. Thanks to your efforts, we now have fresh, comprehensive research on the health and well-being of LGBTIQ plus Australians, which will help improve and, I'm sure, save lives. While the data shows us we still have work to do, none of us can afford to rest until equality in people's lived experience is achieved. Evidence helps. Without it, you can't get anywhere. Data helps. Without it, you can't get anywhere. But it needs to form the basis of people and groups who, from a shared value position, seek, advocate, and will not rest until equality is achieved. So thank you for allowing me the great honour and privilege of being part of this launch. And I wish Private Lives 3 every success in the future. Thank you very much.
Thank you so much for those very inspiring words, Minister. As you say, a lot that we've accomplished, but a lot more still to do in the future. And then it's heartened by your words about the strategy and the other initiatives that you see on the horizon into the future. And thanks also once again for the generous support from both the Department for Health and Human Services and the Department for Premier and Cabinet that made the whole project possible in the first place. So our very sincere thanks for joining us. Our next speaker is Associate Professor Anthony Lyons. Anthony is also a Deputy Director of the Australian Research Centre in Sex, Health and Society at the Trobe, and is the lead investigator of the Private Lives 3 project. Anthony, I know, has a great many thank yous to offer to people from all across the country, and will talk us through a few more of the headline findings. Anthony, over to you.
Thank you very much, Adam, for the introduction. Before I begin, I would like to acknowledge the traditional owners of the land, the Wurundjeri people, which I give this presentation today. I pay my respects to their elders, past, present, and emerging, and I extend that respect to Aboriginal and Torres Strait Islander people here today. Thank you everyone for attending this launch. I'm really delighted to be able to present Private Lives 3. I also wish to give my warmest thanks and appreciation to the Minister for your comments and for all the wonderful support you and the Victorian Government have given to this work. As many of you know, Private Lives 3 has been instrumental over many years in providing an account of the lives, health and well-being of people from across the rainbow and across the country. And as with previous iterations, Private Lives 3 has been a huge undertaking, but none of this would have been possible without the support and contributions from many, many organisations and individuals, both here in Victoria and nationally. Before I tell you some more about Private Lives 3, I would like to give a huge thanks and gratitude on behalf of all the study authors to all of our contributors. Firstly, I wish to give an enormous thank you to the Victorian Department of Health and Human Services and the Victorian Department of Premier and Cabinet, who jointly funded this project. Not only did they fund this work, they also gave support in the form of advice and input at key stages, facilitating consultations with relevant groups, and in many other ways. We are hugely grateful for all of this and for making Private Lives 3 and this report possible. I would also like to acknowledge the valuable and ongoing support from Trobe University for ARCSHS and this work. It is this support and a commitment to understanding and addressing issues of health, well-being and equity that enables projects like Private Lives 3. There are numerous contributors to this, but I would particularly like to thank our Vice-Chancellor, Professor John Dewar, who has given tremendous support to ARCSHS and its achievements over many years. I'd also like to thank the Director of ARCSHS, Professor Suzanne Fraser, for all of her ongoing support and encouragement of this work and all the work we do in relation to the health and well-being of LGBTIQ populations. It is only within this supportive environment that projects like Private Lives 3 and of this scale have the capacity to happen. Of course, the Private Lives 3 study team has been vital in achieving this work. I wish to thank and acknowledge all the hard work and expertise that the study team has given to this project. Firstly, Adam Hill, who has served as the research fellow for this project. From the very first day, Adam enthusiastically and very adeptly took the running with this project. I and the rest of the team are very grateful for Adam's countless hours of dedication and hard work in conducting the survey, also analysing the extraordinary scale and complexity of the data, and working on the report that you have before you today. And Adam Bourne, Marina Carmen and Ruth McNair, you have all been fabulous team members and have made countless valuable contributions throughout this project, sharing your many years of experience and expertise. That includes writing aspects of the report, reading through drafts, providing advice, navigating challenges, keeping up the spirit, and the list goes on. None of this would have been possible without you. Private Lives 3 was also supported by an expert advisory group who gave invaluable support, advice and guidance throughout the project. This included Nikki Barth at the National LGBTI Health Alliance, Teddy Cook from ACON, Michael Daly from the Victorian Department of Premier and Cabinet, Misty Farquhar from Curtin University, Bonnie Hart from Intersex Peer Support Australia, Braden Hill from Edith Cowan University, Sally Morris, Pamela Rodriguez from the Victorian Department of Health and Human Services, Simon Ruth from Thorn Harbour Health, and Budi Siddharto from Australian GLBTIQ Multicultural Council. I wish to give my warmest thanks and appreciation to the advisory group for being so generous with their time and for sharing so much of their knowledge and experience throughout this project. We also had a gender advisory board who gave invaluable advice on aspects of the data analysis. This included Rory Blundell at the Zoe Bell Gender Collective, Teddy Cook, Misty Farquhar, Ivy McGowan at ARCSHS, and also Star Lady at the Zoe Bell Gender Collective. We greatly appreciate the time and expertise this group gave so generously to this project, particularly during the data analysis phase. There are also many more individuals and organisations who gave valuable assistance at various points along the way. I'd like to mention Cal Andrews, Nathan Despot, Tony Carlson, and Amy Peacock. And there were numerous organisations in Victoria and across the country who assisted in promoting the survey during data collection. Just to name a few: Intersex Peer Support Australia, National LGBTI Health Alliance, Thorn Harbour Health, ACON, and also the diversity group in the Victorian Department of Health and Human Services. It is impossible to name them all, but there were countless other organisations throughout Australia who promoted the survey, and we are extremely grateful for their support and efforts. I also wish to thank the Rainbow Health Victoria team, who on countless occasions gave valuable advice and feedback on aspects of the survey, as well as promoting the survey and giving generously of their time and expertise at many other stages. This team does amazing work, and we thank you for your contributions. And that includes Jackson Fairchild, Claire Ferrugia, Jamie Jones, Sharmini Joseph, and Matthew Parsons. I further wish to give my thanks and appreciation to many staff at ARCSHS, both current and former. There were many people who provided valuable contributions towards either initiating this project, giving feedback at various stages, or helping to make this launch possible today. And that includes Stephen Angelides, Beatrice Alba, Dwayne Duncan, Nicole Eckersley, Jake Franklin, William Leonard, Jean Lim, Ivy McGowan, Dulcie Moletta, Jennifer Power, Tom Rosbroy, and Jen Sykes, and also Andrea Walling. And finally, we wouldn't be able to present any data if it were not for all the participants who completed the survey. I wish to give thanks and enormous appreciation to the many thousands from all over the country who generously allowed a glimpse into their lives. Coming from many different backgrounds, they shared their experiences across many aspects of life, and only by doing so are we able to present this report today. So what is Private Lives? Since it began in 2005, Private Lives has sought to provide knowledge of the diverse lives, health and well-being of LGBTIQ people across the country. Comprehensive data is often in short supply, so Private Lives seeks to deliver data that is needed to inform governments, health professionals, service providers, community organisations, and anyone seeking to understand the health and well-being of these populations. It involves a national survey of people aged 18 years and older, and because lives change and society changes, the mission behind Private Lives is to continue to bring up-to-date data by running the survey repeatedly. So here today, we have Private Lives 3. The survey we conducted on this occasion was our largest ever, and we believe the largest such survey ever conducted in Australia. The survey attracted 6,835 participants from all over the country in urban, rural, and regional areas. It also involves the largest sample thus far of trans and gender diverse participants. And as you'll see in the report, the survey attracted participants from many different backgrounds, including a diversity in gender, sexual orientation, age, income, education, multicultural backgrounds, and much more. This diversity has allowed us for the first time to break down some of the responses for some of these key groups to provide valuable data for those sections of the community that may have historically been overlooked. As you can see here, the survey reached right across the country. Our largest sample was from Victoria, with over 2,000 from this state, but thousands of participants were also living in other states and territories. From the very beginning, we sought to make Private Lives 3 as comprehensive as possible. We wanted this work to be able to speak to many different areas of life and inform many different sectors. This slide shows some of the areas such as relationships, health and mental health, housing, disability, and more. We also included specific questions relevant to trans and gender diverse people, as well as people born with an intersex variation. These and other areas are presented in distinct chapters in the report to enable specific areas of focus and to serve as a comprehensive resource. So what are some of the things we found? Although I haven't had the time to count, I can safely say there are thousands of numbers and percentages and many hundreds of findings in this report. But what I will try to do is to provide a brief summary of some of the findings. Before I do this, I wish to highlight that findings presented today may not necessarily be reflective of all people with an intersex variation. Unfortunately, this is a much smaller group in the survey compared to other groups. We worked hard to engage as many participants as we could, and we are extremely grateful to all those who generously took time to complete the survey, as well as Intersex Peer Support Australia and others who assisted with promotion. And in the report, we have provided a dedicated chapter that presents data from this group of participants. So given this, it is important to keep in mind that when we refer to broader findings from Private Lives 3, these may not necessarily be reflective of people with an intersex variation. So with that in mind, I will turn to some of the findings. And the Minister's also touched on some of these findings as well. It is worth noting that there was a range of positive findings. A majority overall reported that they now felt accepted at work, among family and in educational settings. A majority are in committed relationships, and 3/4 reported that marriage equality would have a positive impact in their lives. A majority also said that participating in Australia's LGBTIQ community is a positive thing for them. And we also presented many other positive findings in the report as well. But against this backdrop, there are also significant challenges found. Before we get to these, I wish to flag that some of these include concerning findings related to mental health and suicide. So if these are difficult issues for you, then please feel free to switch off for a few minutes. We also wish to let audience members know that there are available forms of support such as QLife, Beyond Blue and Lifeline. So as I mentioned, there are also significant challenges found. There are still many people who report experiences of social exclusion, verbal abuse, harassment, and threats of physical violence. And approximately 2/5 reported having ever experienced homelessness. Given these and other challenges, it is not surprising to learn that just over half reported high or very high levels of psychological distress. And sadly, related to this, approximately 2/5 reported having had thoughts about suicide in the past 12 months, and approximately 5%, or 1 in 20, reported attempting suicide. These numbers are substantially higher than what has previously been reported for the general population. As we know, accessing appropriate services is important. While less than half felt accepted in mainstream health or support services, we did find that large majorities said that they felt accepted in services that specifically cater to LGBTIQ populations or mainstream services that are known to be LGBTIQ inclusive. We also found that trans and gender diverse participants carried a greater burden in some areas, such as high rates of psychological distress and attempting suicide. Throughout the report, we also provide breakdowns of data wherever possible, according to different populations, which provide further insight into how experiences can vary based on additional aspects of people's backgrounds. Finally, I want to reiterate that this is a very brief overview of some findings. In fact, there are hundreds more in the report, so I encourage you to download it when you can. While the challenges may be confronting at times, it remains important, perhaps more than ever, to continue research efforts. There are many questions of how and why that need to be further understood. And as lives change and as society changes, tracking the health and well-being of LGBTIQ people will only become more important. For now, we hope this report serves as a useful resource. I'd like to finish by thanking again the many thousands of participants who gave their time to share their positive life experiences as well as their challenges. For this, we are very grateful. And thank you everyone for coming along to this launch. We hope to see you all in person in the not too distant future with Private Lives 4. Thanks, Adam.
Thanks so much, Anthony. I think I speak for all concerned working at the centre and others involved in the project when I say this truly has been a mammoth effort, and I know that in the last few months especially, many of us have had long, late nights trying to pull this together. So thank you for that run through and overview of just a few of the key findings that are in the report. Our next speaker is Marina Carmen, the Director of Rainbow Health Victoria. Rainbow Health is an expert knowledge translation training and policy unit that we're really proud to host within ARCSHS. Today Marina's going to provide us with a look back to see where we've come from, as well as a sense of where we might need to be going next. Marina.
Thanks very much for that, Adam. I'd like to acknowledge the traditional owners of the many lands on which we're meeting across the country and pay my respects to elders past and present, always was, always will be Aboriginal land. We're very pleased to be here yet again to help launch Private Lives. Rainbow Health Victoria, previously called Gay and Lesbian Health Victoria, or GLHV, has been part of this research from the start, and we've played an important part in this new iteration. This included helping formulate questions and connecting and engaging with community and partners. It included being part of the data analysis, helping work out what to look at and make sense of the data in context. And we'll now play an important part in making sure that the results are known far and wide. Private Lives is yet again the key national data set for understanding what LGBTIQ people are saying about their own lives. And we will be working hard for the foreseeable future to recommend and advocate for change based on these results. So before saying anything else, I wanted to particularly thank all of the participants. It's such a huge achievement to have so many people complete the survey. On a personal note, when we started to see the results, the project team have all had our moments when we worried about how to report some of the confronting findings. But in the end, we're glad to have this data out there. The participants already know what's good and what's wrong in their lives, and they told us, and now we get to tell you. Before I move on to talk about what we think this all means going forward, I wanted to take a little look backwards. So I took the time recently to go back through all of the old Private Lives reports and also to dig through our archives. And I managed to find some pictures from all the previous launches of the survey. It really made me feel like doing some sort of sector celebrity bingo, but I kept with decorum and you'll just have to play along at home. So here we have the very first Private Lives in 2006. Moving on, and 6 years later, here we have the second Private Lives in 2012. Then in 2015, we launched a closer look at Private Lives 2, and some of you may recognise our old offices in Franklin Street. And this reanalysis of the PL2 data was focused specifically on mental health and wellbeing. Then that brings us to today, 8 years on, and with some slightly more modern design work. It was really interesting going back to the earlier reports and looking at the recommendations. And as you can see, the themes are remarkably similar, and it allows us to see what has changed and what still needs to be done. So obviously, since 2006, we've had some important legal changes, though there are still gaps in areas such as adoption rights, birth certificate reform, though we would acknowledge here the work of the Victorian government, and current challenges around supposed religious freedoms bills. And what these legal changes reflect are underlying improvements in social attitudes, although this is particularly regarding sexuality, although this is less so for the T and the I in our umbrella. And there has also been concerted and successful advocacy to challenge and reform pathologising medical definitions and models, though again, this is incomplete. And there has been an investment in services and programs aimed at delivering affirmative and inclusive care, as well as promoting pride and social support. But we can see from the results presented in the report, stigma and discrimination are still present, and the resulting harassment, violence and abuse continue to have negative impacts on LGBTIQ people's lives. We're hopeful that it's a good thing that LGBTIQ people are able to report these negative things in their lives rather than just accepting them as normal. It's also a major step forward that so many people reported that they felt that their sexuality, and to a lesser extent their gender identity, were respected when accessing health and community services. We should take note of these achievements. However, it's also clear that many more people wanted to access LGBTIQ community-controlled services than those who did or perhaps could, and there is a high demand for inclusive and mainstream services. And especially in the current context of crisis arising from COVID-19, these needs are immediate and serious. So what now? We would suggest 4 main areas. In terms of policy, where there is evidence of greater risk or specific need, it's necessary to both include and prioritise LGBTIQ communities, and this is incomplete at both the state and a national level. Many are also increasingly arguing that it's necessary to look further upstream to the underlying social inequalities that are driving poorer outcomes for LGBTIQ people, and to address these through a focus on prevention. What we're talking about here is continuing to drive generational change, and we shouldn't be daunted by that. It's happening already, it's exciting to be part of it, and our job is to speed it up and minimise the really, really significant harm happening to people during this ongoing seismic shift. In terms of services, there's a continuing and urgent need to invest in a service mix that gives LGBTIQ people a choice of affirmative providers in different geographical areas and settings for different issues and needs and at different times in their lives. Moving on to data and research, there's a continuing need to understand more. We need more and better service level data and population level data that allows comparison with the general population. And the Victorian Population Health Survey report recently is a major achievement in this regard. We also need private lives to run again, and with a shorter gap than the 8 years since the last full survey was run. And we need other research, so additional analysis of the PL3 data, as well as other qualitative research that tells us more about why things are happening and what this means in terms of interventions. So thanks again for all your support and engagement throughout the whole period of producing this study, and we look forward to working with you all into the future.
Thank you so much, Marina, for that review of our past, and it was wonderful seeing those photos in there, including, I noticed, one of a particularly youthful health minister. I think we could probably forgive Minister Foley for a rapid aging in the context of COVID. It's at this point in the proceedings, I hand the reins over to my colleague, Jackson Fairchild. Jackson is the head of policy and programs within Rainbow Health Victoria at ARCSHS and is a vital member of our team. Jackson's going to introduce our panel and what I'm sure will help facilitate what I'm sure will be a really great discussion. Jackson, it's over to you.
Thanks so much, Adam. It's great to be here today. As Adam said, my name is Jackson Fairchild and I'm the head of policy and programs at Rainbow Health Victoria, and my pronouns are they and them. I would also like to acknowledge the traditional owners of the land in which we live and work, which is for me the Wurundjeri people of the Kulin Nation. I would like to pay my respects to elders past and present and extend that respect to all Aboriginal people joining us here today. I'm delighted to welcome 3 guests who have joined us to share their expertise and thoughts on this very important research. Today is, of course, just our first look at Private Lives 3. This data is rich and very, very complex, and we've only just begun to really explore what it can teach us. Our discussion today is, we hope, the first of many in our communities as we unpack this research and what it means for each of us. Each of our guests played an important role in the success of this study, either as part of the investigative team or as highly active members of our expert advisory group. So without further ado, I'd like to welcome our first panel speaker, Teddy Cook, who is a very involved member of the expert advisory group. Teddy is ACOM's Manager, Transgender Diverse Health Equity. He's also the Adjunct Lecturer at Kirby Institute and Vice President of ANZPATH. He works across a diverse range of policy, education, health promotion, research and advocacy projects aimed at improving health and rights for trans people of all genders. Teddy and his team are also responsible for bringing you the award-winning Trans Hub, ACON's one-stop shop for information and resources for and by trans people in New South Wales. Thanks so much for joining us here, Teddy. I was wondering if you could share with us a finding that really jumped out of you in this research.
I can, and thank you so much for inviting me to be on this panel. I'd also like to acknowledge that where I am right now and where we are always is Aboriginal land. I'm on Gadigal land, which is one of the 29 clan groups of the Eora Nation. We could talk about the outcomes and the symptoms that are experienced by trans people of all genders in this sample. We could talk all day about the extreme distress, the suicidality, the disconnection from family, from culture, from faith. We can talk about the significant violence, the discrimination at work, in healthcare, in education, in public, at home, and that participants experiencing intimate partner violence felt the least supported by police, even though only a minority reported to them. And all of this, of course, has been exacerbated and compounded by COVID-19, right? We could talk about it all day because these findings are really, really shocking. And they tell a story of what happens to trans people when we're not able to expect fair and equal treatment in the communities that we live in. So actually, the finding that really jumped out to me was that less than half of trans women, less than half of trans men, and a quarter of non-binary participants could not easily access the gender-affirming healthcare that they needed. That's outrageous and something that we should be very, very concerned about. Very concerned about. What we know is that access to gender-affirming healthcare, whatever that looks like, is medically necessary, clinically relevant, and urgent. And any delay is unacceptable. That's the finding that really stuck out at me.
Thanks, Teddy. And can you tell us some of the ways this research might inform your work and advances LGBTIQ communities more generally?
Yeah, so I'll say this as ACON's Manager of Trans Health Equity, but I'm also saying this as Vice President of OSPATH. These findings really confirm for me that gender-affirming healthcare in Australia is in a crisis. That much is clear, and that this is a real call to action for us all, And the reason for that is because the evidence is really clear. Access to gender-affirming healthcare is a protective factor, and trans people, binary and non-binary, are suffering. Trans people, binary and non-binary, who are able to access the gender-affirming healthcare that we need, tend to report significantly better health and wellbeing outcomes, improved mental health, quality of life, and are less likely to experience suicidality. And so given 90% of our sample had ever experienced suicidality if they were trans, and that those who had attempted suicide in the past 12 months were also more likely to be trans, access to gender affirmation, whether that's hormones, surgery, or a haircut, is always clinically relevant, always medically necessary for those that seek it. And so what does that mean in terms of our work? Well, it means no more excuses. It means equitable and intersectional focus, particularly for sister girls and brother boys, particularly for trans people who are refugees, particularly for those trans people who are Medicare ineligible, a harm reduction focus that is patient-centered, informed consent-driven, and human rights focused, and local and everywhere. So what does that mean? Well, for me, and this is something that I feel really passionate about, if you haven't noticed, models of care must situate gender-affirming healthcare as a protective factor from harm and be positioned in primary care. And that means GPs. Every trans person in Australia should be able to access the healthcare we need where we live. No excuses, and throughout the lifespan, whether we are 1 or 100. We should be able to be in, I'm going to say some New South Wales references, so let's see if they translate. Wilcannia, let's just say the middle of nowhere. We should be able to access the care that we need when we need it. That's going to be a big focus. It is a big focus of my work, but delays, whether they be structural or political or ideological, harm trans people. And the need, I got to say, for non-binary medical affirmation protocols is more urgent than ever and must be prioritised. And that's a big long list, but
it's a good list, though. It's an amazing list. I think there's a lot for us to think about, and thank you so much for sharing that with us today. There's a lot more conversations that will need to be had.
Look forward to it.
I absolutely look forward to it. It's going to be great. I'd like to welcome our second guest, Dr. Ruth McNair, who is one of the investigators on this project. Ruth is an honorary associate professor at the Department of General Practice at the University of Melbourne and a GP and founding director of an inner Melbourne general practice. She has clinical and research interests in lesbian and bisexual women's mental health, sexual health, same-sex parenting, LGBTIQ healthcare, disability and homelessness. Ruth has expertise in medical education and has developed LGBTI online training modules. She's also a life member of the Victorian Gay and Lesbian Rights Lobby and the Victorian AIDS Council, and was inducted into the Victorian Roll of Fame Roll of Women in 2017 for her academic, clinical and advocacy work. She became a member of the Order of Australia on the Queen's Birthday Honours in 2019 for significant service to medicine and an advocate for the LGBTI community. Ruth, I suspect there's a lot more I could be saying, and we've actually shortened that list. It's wonderful to welcome you here today. We've just heard some wonderful insights and reflections from Teddy. I was wondering if you could share with us the finding that stood out for you most in this research.
Yeah, well, thanks, Jackson, and thanks, Teddy, for your words. And I interestingly focused in on exactly what you were thinking as well. So thanks, I totally agree. I think the problem with the LGBTIQA+ acronym is we're sort of all thrown together and it feels like we're more similar than different in that acronym. But what strikes me in the findings is that we actually are more different than similar now that we can dive down in and look at different subgroups much more effectively. So, you know, it would be very different. It is very different, as we can see in the report, to be, let's say, a cis, male, gay, white, able-bodied person in Australia than it is to be, let's say, a pansexual, non-binary person with a disability. And, you know, it's so striking and it's really hard to, I guess, look at all of those intersections and combine them all into one person. But if you think about all the disadvantages that might arise for a person with multiple marginalisations, you know, you can see it in the report. So I wanted to sort of point that out. The other thing that strikes me, and I'll put my GP hat on, I totally agree with Teddy around the idea that we're needing to focus in on primary care. And, you know, you can look at the general health population, the general health data, and this is just one snapshot. You know, this is the question that's asked about how do you feel your health is at the moment? And there's a range from poor to very good. Only a third of this group overall thought their health was good or very good, which is really low. Well over half the general population would think their health was good or very good at the moment. But then if you dive down into the subgroups, you know, only 20% of the non-binary people thought their health was good or very good. Only 20% of the trans women thought that. So, you know, it does vary enormously across the groups. And I think that's a really important finding and will hopefully help us in thinking about the subgroups much more effectively.
Thank you so much, Ruth. That's yeah, an extraordinarily, you know, it's a very valid point. And as we look at these from different angles and as we continue to explore that data and analyse it from and have those conversations, we're going to find out more and continue to come up with solutions on how we can improve things for people who are experiencing those multiple marginalisations in society. Can you tell us a bit more about what this research means for your practice and the advance of LGBTIQ communities more broadly?
Well, I was sort of interested to look at how many people were accessing LGBTIQ specific services, and it's very few, you know, like my practice. It was about 5%, I think. And that's because there aren't many around. They're very urban-centric or inner urban-centric. And as Teddy was saying, you know, what we're aiming at here, what we should be aiming at is mainstream health services that are accessible to everyone in every location. And not just accessible, but LGBTIQA+ inclusive, overtly inclusive. So that's the sort of area I want to continue to work in. I was heartened that a lot of the people in the sample had a regular GP, and many more trans and gender diverse people had a regular GP than even the cisgender people in the survey. So, you know, that was great to see. My my remit, I reckon, is to get out there even more to those GPs and say, you have LGBTIQ people in your practices right now. You cannot turn a blind eye. You cannot say they're just the same as anyone else. Here's data that really emphasises the things that are not the same that you need to take notice of, and to build that capacity in mainstream to be really effective at all levels for our population groups. So I'm sort of girded by this report to get out there and tell more. You know, I'm doing my regular family planning Victoria gig next week. I've already inserted loads of slides from Private Lives 3, the beautiful little charts, into my talk to say, here is some really up-to-date data of over 6,000 population in this country that you need to look at. So I think that'll do from me. Thanks.
Thank you so much, Ruth. You know, I think you're absolutely right. This information is going to be a really powerful tool in our toolbox as we move forward, as we, through training, as we talk and advise to the government, as we communicate within the community, as we just seek to understand what it is that we're feeling and what it is that we can do about it. This is going to be an amazing tool for all of us. And I hope that those listening in the audience can take this as an opportunity to think about what this data could be used for in your work or in your life, in order to be able to make sure we get the best possible impact for us as we move forward. Lastly, I'd like to welcome our last panel speaker, Simon Ruth, who is also a very involved member of the expert advisory for this project. Simon is the CEO of Thorn Harbour Health, formerly the Victorian AIDS Council. He sits on the board of the AIDS Trust of Australia and the Pride Cup. He has a 30-year career in health and community services. Thorn Harbour is Australia's oldest HIV organisation and one of its largest LGBTI community-controlled health organisations operating in Victoria and South Australia. Thanks for joining us here today, Simon. We've heard some amazing insights and reflections from our earlier speakers. Can you share with us a finding that's jumped out for you as you look at this research?
Yep, thank you, Jackson, and happy NAIDOC week. And I'm coming to you from Bourne country. Always was, always will be Aboriginal land. I guess it's a pretty dark report, though not completely dark. That's the first thing to note. And inequity is certainly not even across all parts of the rainbow, and Ruth and Teddy have both talked to that. I think it's interesting that all these health inequities have always been here. You know, they didn't occur in the last 12 months. We haven't just suddenly found them. But they've sat in the background while HIV has dominated our worlds for the last 30 years. And it's really only as HIV is starting to settle in Australia, we're starting to get control of it. We've got PrEP out, undetectable viral load, and we're managing to get that in check, that suddenly research is bringing all these other things to the fore. And I think one that says a lot about our community resilience and our capacity and how our ability to cope. But most of our community resources are still very much invested in HIV. The larger LGBTI orgs right across the country are majority HIV funded. The vast majority of the research that occurs in our space is driven by HIV. And I think we need to ensure that as HIV gets more under control, that these dollars don't drift away into other areas of health. We don't want to lose our dollars to COVID. We don't want to lose our dollars to hepatitis or other viruses or other infectious diseases. We want to ensure that our dollars stay within our communities, and that the dollars can be redistributed to tackle other things. And I think that's an important thing to, ensure that we're all active about. I think you can also put a dollar figure on a lot of the services that we need to develop, but it's clear from this report that the trauma and the social impact of what's gone on in our community, we will never be able to put a price to. Whether it's from some of the terrible things that are in here or whether it's from walking into a new doctor's and they ask you about your private life and you just sit there and you do that momentary thought of, I don't know how they're going to react, so I'm going to lie or I'm going to change the subject. Every one of us go through it every day of our lives as queers. The report prompts a lot of questions. I think the more you read, the more you want to know and the more questions you ask, and then the researchers like yourself and the others say, well, we could only ask so many questions in the report. And I think there is a question around people's understanding of what some of the phrases meant. LGBTI inclusive, what that means for me is probably very different from what it means for somebody else. What is a mainstream service? Even some of the language is clearly changing. I think last time we did this report, non-binary did not feature in this report at all, and this time it's a very prominent aspect of the report. The term lesbian, the number of and range of people who call themselves a lesbian is probably different to what it was last time the report was done. One of the things I think is interesting on page 76, if anyone's got it open, are the sexual assault figures and lifetime sexual assault. Generally throughout the report, cis people do better than trans people, and then non-binary people do worse. In the sexual assault figures, cis women and trans men have significantly higher rates of lifetime sexual assault than cis men and trans women. So clearly there's a relationship here about assigned female at birth, and that needs to be explored more, and whatever comes from that will then have an impact on how we develop services and how we develop campaigns and how we talk to the community. Or it could be just completely wrong, and you know, but there is something there we need to look into more. And I think another interesting point is on page 26, the religion figures. 74% of us said we have no religion. In the national census, that figure sits at 30%. Christian faiths, Islam, Hinduism, all significantly down. Judaism, bizarrely, 3 times higher than the rate of the census. Buddhism sat evenly. But I think that figure of no religion is significant because it goes to where we find support and how we develop community and where we can find those things. So in Australia, you know, if you move house or move states, you tend to find community in your workplace, potentially in sports clubs, and in schools and in churches. And when LGBTI people are clearly walking away from religion, for a large proportion of us, we're less likely to engage in sports. We have poor experiences at school, and then a lot of us don't come out at work. It has a big impact on how we develop community. And so we are more reliant on developing our own communities and ensuring that we have strong community assets and our organisations are strong and vibrant, because they're required by people coming out and people moving, and we need to have all those in place. And I'll leave it at those two.
Thanks, Simon. You've sort of answered both questions in one there, but would there be, just thinking about all those points that you've just raised, is there any one particular thing that you think we should be focusing on moving forward?
That's not the second question you gave me, Jackson.
What do you think? What do you think this means for your practice and your?
So for us, you know, this research is incredibly important. It's a wonderful report. It's a huge report. We will spend years going through this report. And it sits aside a whole bunch of other reports. Julia Taylor's work that also came out of ARCSHS around bisexuality, writing themselves in, that we know is on the horizon next year. And then stuff from New South Wales, like the Gay Periodic Survey and the SWASH study and the Flux study. Transmedical research coming out of Melbourne Uni. And all together, you know, it all has a massive impact on how we develop services, on how we develop campaigns. And particularly for Thorn Harbour as a bit of an activist organisation, in Victoria on the horizon, we have conversion practices, which is about to hit Parliament, and it's about to be legislated. We have vilification legislation. We've got a mental health Royal Commission. We're still, you know, coming out of a family violence Royal Commission. So this sort of evidence is how we put our case to government for what needs to occur. So this, we're already using this data. I think I've got letters ready to go out today to politicians to raise their awareness of it, and to ensure that they're thinking about our communities when they're making policy decisions, particularly around COVID, around throwing millions out to mainstream services and actually not remembering that a lot of our communities struggle to use those services. So it's an incredibly important report, and it'll be put to very good use.
Right, Simon, and I'm just reflecting on just how much of a team effort this is as you spoke, and we talk about all the different research. I'd like to acknowledge all the rest of the amazing research that's been happening. Incredibly important data being led by different sort of institutes, research centres and communities, and the important part of services and community advocacy groups, and they play in bringing this all together to be able to create the change that we hope will improve this data in private lives for, which I think is what we're all collectively really, really hoping for next time we have the opportunity to meet in a similar space and reflect on how things may have changed. Thanks so much to each of you. We're at the end of our time here today. I wish we had more time. This is going to be the first of many conversations like it, both in spaces like this and within the community. And it's incredibly important that we think about what this information can be used for and what our reflections are. And it will not be the first, it will not be the last report or analysis of this information. And you can look forward to that unfolding more over the next couple of years as we continue to explore this data set. If any of the information presented here today has been challenging or distressing for you, we encourage you to call one of the numbers that has popped up on the screen now. I would like to encourage you to reach out to those services and have a chat. And I'd also like, on behalf of ARCSHS and the community, to thank each of our speakers for their incredible contributions to today's launch. I'd also like to thank each of you who have joined us today, and I wish you well and I hope you have a wonderful afternoon. Thanks so much, everyone.